Good morning, everyone. It's Thursday, August 12th. Welcome to the Morning Medical Update. I'm Jill Chadwick, in for Jessica today as she drops her little one off to the first day of class. I think he was a little bit traumatized today, and that makes Mom a little traumatized, too. I understand that. Coming up, Jessica, like a lot of parents and grandparents and caregivers, are a little anxiety-ridden as thousands of kids go back to classrooms this week with some unknowns ahead of us. Our experts have good advice as we tackle the start of another school year, plus how the pandemic has impacted yet another aspect of our health, and it's your eyes. You're going to learn some things this morning that you may not have heard before. But first, Dr. Hawkinson joins us with the COVID count. Good morning. How are the numbers looking?
Hi. I'm good. Yeah, I mean, there certainly seems to be ramping up a lot of consternation and anxiety and anger about having children wearing masks. So, I don't envy those people who have to make those decisions, whether it's in those institutions themselves or in the school districts themselves. Certainly, they have a lot of influences that are playing on those decisions. Today, the numbers are, they were a little bit higher overnight. We do have 47 active infections with 19 in the ICU and 11 on the ventilator. We still have 15 additional patients in that recovery period as well, so 62 total. Hays has 8 active and 1 in that recovery period as well. So numbers creeping up just a little bit. I'm hoping, when we will see some plateau in cases and hospitalizations. Obviously, we know hospitalizations do lag behind cases, but, just keep getting out there. We'll see how things go once school starts. We know that schools can be opened safely if the right things are done, and that children and the adults in those schools don't spread it to each other during the school times. Obviously, when they get out of school and in those other situations is probably the riskiest point.
All right, thanks. Don't go anywhere. Do we have reporter questions on the line?
Oh, sure. Hi, it's Cody with Channel 9. I got a couple for you, Doc Hawk. This one just came out of the blue as you mentioned masking. I'm curious, part of the argument is, it's hard to keep them on kids or whatever. Is there a specific kind of mask that doctors are recommending for younger people to wear that might be more comfortable? Or is it just a face covering is a good face covering?
No, I mean, I don't think anything has changed since a year ago. We have had some pediatricians on the show. We have had psychologists on the show. We happen to have a very good one today. And all of them recommend, really any mask. And the issue is, children otherwise do very well with the mask. I don't believe, and I'll be corrected by my colleague here in just a little bit, I don't believe that there's been any sufficient data suggesting that children have significant anxiety or problems wearing a mask. I think in the general, they do it a lot better than adults do. In fact, they even wear playing sports, which I know I could not do any activity, even if it's just walking outside wearing a mask. So they tend to do it a lot better, a lot easier. There are concerns about masking causing more illness because maybe it's dirty. I think what our pediatrics colleagues will tell you and Children's Mercy will tell you is that they didn't see a lot of people during the height of the pandemic when everybody, including children, were wearing masks at school. We didn't see people coming in for pneumonias or other respiratory viruses. Really, it wasn't until the masking stopped that we saw more transmission of illness throughout. So, no specific. I think still just those cotton masks that you can buy anywhere. Certainly, we know a lot of either grocery stores or pharmacies are also selling surgical masks. Those are reasonable as well. And other places, if you can buy KN95s. But I don't think there's any specific type, and I don't think there's been any new guidance that you need one over the other.
All right, do you have a follow-up question?
Yeah, CDC yesterday strengthened the call for pregnant women to get their coronavirus vaccinations based on new data, and I was curious if you could just expound on that a little bit and why they're making that decision.
No, I think it's that simple. I think they, number one, looked at the increased risk of if you are pregnant compared to if you aren't pregnant, and those women that are pregnant do have a slightly higher risk of having more severe disease and going to the ICU. So that played into it as well. And we also are getting more information that you do have some transfer of antibodies from mom to baby through the placenta, prior to giving birth, which is important. So I think it was based on that, as well as the incredible safety profile that they did see when they were able to analyze pregnant women who did get the vaccine.
And I might just add that we're going to have Dr. Alt on tomorrow, who's with the CDC ACIP committee, and he's also an OBGYN, and he's going to talk in depth about that issue. So do you have another follow-up?
Oh, I'm good. Thank you.
Okay,
Thanks.
we do have one from KCTV5, and they wrote in this morning, and they said there's a couple of local Olathe doctors writing mask exemptions for kids for school. What's your reaction to this, and what would be your advice to such doctors? Is this a bad idea?
Yeah, I would always defer to my pediatrics colleagues for this. However, we know that there are, in some cases, there are subpopulations of pediatrics who do need, for one reason or other, legitimate reasons, do need to go mask-free. But in general, most all of the children can tolerate the mask, and I think this kind of goes back to the individual health, that individual patient and their doctor in making that decision. I don't think I can say anything other than that, but in general, masks have shown to be very safe and effective and very tolerable for these children. So I think it kind of goes down to the individual and just really understanding why that mask exemption is being written. Can't really comment on it if it's legitimate or not, because we don't always know all the details of that doctor-patient relationship.
All right. Well, thank you, Dr. Hawkinson.
Yeah.
We are now going to turn to our guest today. Our ophthalmologist, Dr. Annie Wishna, is here to discuss eye health, and clinical psychologist, Dr. Greg Nawalanic, I know your name, here with some back-to-school advice. Good morning. I want to start off by saying that you sat down today and we were visiting, and you said some ophthalmologists are calling this the STI pandemic.
Yes.
What is that?
Yes. Well, so STI is when there's a blocked oil gland in the eyelid, and then everything kind of blocks up behind it. There's natural oils there that are part of the tear film. So it's kind of like a pimple in the eyelid. You can get lid swelling, a red eye. This can be painful and uncomfortable. And I do think that it's related to stress. So we all know we've had added stress with the pandemic. So there's been more STIs. The best treatment is really to put warm compresses on it for an extended period of time. My little trick is to get a washcloth wet and put it in a Ziploc bag and then put it in the microwave for about 20 or 30 seconds. Then seal the bag closed, and then that'll stay hot for a long time, because if you just put hot water on a washcloth, it'll be cold in about 2-3 minutes. Then you want to do that 20 or 30 minutes at a time, and 9 times out of 10 that'll take care of it, and there's no need to get medical attention right away. But if it's not getting better, it's getting worse, there's a lot of swelling, any change in vision, double vision, then it could be something more going on, and I would recommend getting it checked out.
So you take the plastic bag and you seal it after you've warmed it, and you just put the bag and everything on the eye?
Yeah, I'll usually wrap it in a thin towel, like a kitchen
Okay.
towel. You don't want to burn your skin, obviously.
Right.
But then it'll stay warm for an hour or so.
Okay, so let's just cover some basics right now. And at the very beginning and throughout this pandemic, when we've ever been on traveling on planes, and Dr. Hawkinson is one of the people that has taught us that we want to wear eye protection. Can you get COVID through the eyes?
You can. Your eyes are a mucous membrane, just like your mouth and your nose. So if COVID particles land on your eyes, you could get COVID that way. So when we're seeing patients in the hospital, that's why we wear eye protection. These are my safety glasses. I actually flew this weekend, and I wore these along with a mask. And usually, I do it at work all day, but if I'm in close contact with people indoors for extended period of time, it's a good idea to have eye protection. So, if you can reach out and touch a stranger and you're going to be in that position for more than 10 or 15 minutes, it's a good idea.
What about contacts in COVID?
So it's fine to wear contacts during COVID. I actually wear contacts. The concern is just you don't want to touch your eyes, because if you had COVID particles or anything else on your eyes for that matter, it could get in the eye and cause an infection. But just if you avoid touching your eye, there's no problem to wear contacts at all.
And one more basic, if we wear glasses, like I had to put mine on because I can't see up close, how do I keep that from fogging, my glasses from fogging when I wear a mask?
Yeah, so there's a couple little tricks. I've got my mask right here. Like one thing you can do is just flip the ear loop around like that, the opposite way. Sorry, having trouble showing that. But so then that kind of helps vent it down a little bit instead of up into your eye.
Right.
Also, if you make sure that the bridge of your glasses is like kind of tucked, your mask is kind of tucked under the bridge of the glasses, that also kind of creates a seal and keeps it from fogging up. There are anti-fog sprays that you can buy, or even just doing a little bit of water and dish soap and letting it dry can help prevent your glasses from fogging up.
Those are all
it
really
is annoying.
It is. Those are all great tips too. Let's talk about COVID eyes and health. How does contracting COVID impact eye health? Are you seeing anything?
I mean, it's rare, but it certainly can happen. Basically, COVID can cause immune response, or it can cause blockage in blood vessels. So that's kind of how COVID causes problems throughout the body. So it's the same thing in the eyes. So it can cause inflammation in the eye, inflammation of the optic nerve, blockage in the blood vessels, in the retina. So it's pretty rare to see, vision-threatening complications like that due to COVID, but we have seen it, and unfortunately, we've seen a case at Children's Mercy. It was both eyes and a child that did lose vision. So while that's rare, it does happen. And also conjunctivitis can be a symptom of COVID as well.
Is that pink eye?
Pink eye, yes.
Okay. So if we get pink eye, should we be tested for COVID?
I think so. I mean, I test all my patients with viral conjunctivitis for COVID. Just because you have a red eye doesn't mean you have viral conjunctivitis, but the symptoms would be like red eye. Usually it'll start in one eye and then go to the other. Kind of your eyes stuck shut in the morning. You might have swollen lymph nodes right here. And you probably would have other upper respiratory symptoms like a stuffy nose, runny nose, cough, or, of course, if you have other COVID symptoms. But every patient I see with viral conjunctivitis, I do test for COVID.
Okay, so I went and got my annual checkup for my eyes, which I know you would highly recommend for kids and adults. And my eye doctor had to bump up my prescription, and it surprised me. And he said, "Oh no, I'm seeing it a lot since the pandemic." I asked him why, and he said, "Too much screen time." Is that?
I personally haven't seen that as much. I mean, it may be, as the eye ages, the lens in the eye loses flexibility, so we need more help to see up close. So it may be if you're on the computer for long hours that you're noticing more, you need a little bit more help to read. So I don't know if it's actually making your eye worse, or you're just noticing it more because you're spending more time on the computer. So it's not dangerous to use the computer or do those activities.
Okay, so I have a personal question for you, and then we're going to move into Dr. Nawalanic. You, as a parent, signed a letter to some school board.
Yes.
Across the metro. Tell the people why you did that and what that letter was about.
So I worked with a group of other doctors who were concerned parents, and we wrote to, I think the letter ended up going to 17 different school boards in the area. It was signed by over 200 doctors, basically giving documentation for that masks are effective, that the Delta virus is a game changer. We have a low rate of vaccination in our 12 to 18 population. Of course, kids under 12 can't get vaccinated, and that masks are effective. The CDC, the American Academy of Pediatrics, the Kansas Department of Health, I live in Johnson County, their Department of Health all recommend universal masking in schools K through 12. So we just felt that there is a vocal group of people that are anti-mask, and we wanted to make it clear that there is, unfortunately for the main part, silent majority that is pro-mask, wants to do the right thing. And I did this because, of course, I'm concerned for my kids. I want them to go to school in a safe environment, but I'm much more motivated. I'm very concerned for our community. If they're not masking in schools, that means that COVID will be much more widespread in our community, and that affects each and every one of us. A child may bring it home to a vulnerable family member. If there's more people with COVID, that overruns hospitals. So it just has a ripple effect across our entire community.
I'm struck by the silent majority. comment, that, and Dr. Nawalanic, I want to bring you in. I feel that sometimes, where people are looking at me because I'm wearing my mask. And if I were a different personality, it might make me feel uncomfortable. It does my daughter when she's with me and she's an adult. What is happening?
Wow, I mean, that's a can of worms that we can certainly dive into. Let's do this. I think that we live in an age right now where social media has kind of become the front of the cereal box for kids to this bunch of really angry folks who don't like what's going on. And when I reference a cereal box, what I mean is anybody who's ever had a kid bring either a box of Lucky Charms or something to him and says, hey, it's got no fat, or something, they put stuff on the front that fits your story. It fits what you need to say. It makes your parents feel like, oh, maybe this isn't bad for you. Look, I'm going to make this argument. This is good for me. And the reality is that it's baseless. It's not, sure, that in that case, it's actually more true that, that it might not have fat, but the sugar is what's going to be the problem. And so we would be wise to stop doing this thing that I think a lot of folks have started to do, where we see headlines or little sound bites and we grab onto the little tiny shred or nugget that fits what we want to believe, and we just discount the actual broader facts and the information that we've seen throughout the outset of this pandemic and that remains true to this day, and that would be masking. If we look at the data, it's clear that when we were all masking everywhere we went, that the numbers went down. We bent the curve, things looked good, and then I would argue, unfortunately, an unpopular opinion here, that the mask mandate being rolled back in the manner in which it was put too much faith in us as humans, that everybody would just follow the rules and do the right thing, and that if you weren't vaccinated, that you would continue to mask. Now, the ignorance of that is knowing that the people who aren't going to get the vaccine, a lot of them, granted that's excluding those with actual health issues, but the rest who are driven by social media and politics hate masks, and they were dying to take them off. And the fact is, the reason they were still wearing them is that they couldn't come in a place without it. So once we pulled that back, they became, like I've said before on here, the wolves in sheep's clothing, who were just coming around and giving us exactly what we were talking about, the dirty looks, because this is such a hot button topic, a hot button issue, and it's really been perverted and steered in a very unfortunate way.
Okay, so I'm going to say the R word, resentment. It seems like we've moved in some ways and places from being sad and scared to now there is resentment as this divide seems to get wider. Resentment from people who are doing the right things, and now people are still getting sick and they're overcrowding the health system. How do we deal with that?
So that's the $64,000 question, to use a very dated reference.
You the hard one.
I know. Number one, I want to throw back actually to something that Doc Hawkinson said earlier, which is that kids, because this really blew up again around schools opening, and when different school districts came out and said we're not going to do masks, and certain governors in different states who are as misguided as the day is long come out and say, we're actually going to stop funding if you try to make people wear masks and this and that. And it just speaks to the emotionality around this. And critical thinking goes out the window. And what we're seeing there is this kind of, parents who have a problem with masks, because parents, a lot of them do, kids don't have that problem, and the kids are going to follow what the parents establish in the home. So however you choose to present this to them, they're going to listen. They trust parents. It's how this works. And so when, I'll give my own personal example. Our kids, they're no better behaved than any other kids in the world. They don't like to do things that don't feel good. They don't like to listen all the time. Bless their little hearts. But when it came to masking, we made it clear, if you want to go to school, you want to be around your friends, which, yeah, we do. You want to go see your teacher in person? Yeah, we do. Okay, so then you've got to wear masks. And it got to a point where, we gave them a little warm-up time to do it, as I'm sure a lot of folks did. And then when they went to school, they would come out for pickup time, and I'd have to remind them to take them off. I'd be like, you can take your mask off. Oh, they didn't even know they had it on. And so I'm tired to death of hearing parents say, it's inhumane, my kids. It's not about the kids. It's about you. It's about your own personal battle that you're trying to wage, and it's disruptive and it's inappropriate.
It's like maskitis. Like, you don't want any itis. That just sounds bad, but
Right.
That's another one.
Yeah.
Conjunctivitis, maskitis.
There it is, all of it.
Stay away from the itis.
No
I do
itis.
think it's important to mention that I think everyone wants the same thing. Everyone wants kids in school this year, and masks are the best way to do that. We're all in this together, like it or not. So it's just, that's a fact. That masks are the best way to keep, they said at our school board meeting, butts in seats at school this year.
Yeah, so we know that some schools are not requiring masks, so I want to know what keeps you up at night, I want to know what keeps you up at night, and I want to know what you think the prediction is going to be in these schools where they're not masking. So start with you.
Another good one. What keeps me up at night around this is knowing that the proof is in the pudding. We've seen what the masks can do. And when we come out in just pure ignorance and make a poorly informed choice around a more virulent strain of this virus that we know is having a more significant impact, we know spreads faster, and here's the most important part, we know that it's targeting kids more than COVID first round. So when we see Delta attacking our kids, and we know that that's a potential, and we're saying, yeah, you know what, let's pull the goalie, let's just see how this goes. It breaks my heart, and it makes me hurt a little bit inside, because if we put out consistent messaging, which has been, if we're going to be honest, the problem of the pandemic from the outset is that there's never been clear, consistent national guidelines, and so there's so much gray area. Whenever there's gray and uncertainty, that's where different subversive interests come in, and that's where they get their buy-in and ability to manipulate and persuade people to be led astray and make poor choices.
And you, Dr. Wishna?
I mean, I agree. The Delta variant is a game changer, and it's very scary. What worries me most is actually that the constant need for quarantining. If there is a child in a classroom that is unmasked and that child tests positive for COVID, that whole classroom then has to quarantine. So my fear is just kids won't be in school. It'll be week after week of quarantine after quarantine. And that doesn't just mean kids won't be in school. That means parents won't be at work. That just has a really negative impact across our community. And I agree that, being able to listen to the experts and understand there's nuance to the situation. This is an ever-evolving situation. As you guys always say on this program, we're building the plane as we're flying it. It's important to model that intellect and that behavior to children, especially as educators and school boards. Like, school boards should be able to understand, to listen to the experts and the scientists, and they should be modeling that behavior.
Dr. Hawkinson, I've heard you talk about that trickle-down effect,
Yeah. I think it's a difficult decision for all of these elected officials or appointed officials to make in this situation. But I think you have to make it with the knowledge and the understanding that you have a good base or a foundation of knowledge to make that. And you're making these decisions on true facts and not opinions such as, or myths such as, COVID doesn't affect children. That's absolutely not true. That is the biggest false statement. I think it started probably early in China with some of the information, and here. Why is that? Well, number one, schools shut down. Children mostly are asymptomatic, thankfully, and they don't have to go to the hospital. And also we were only testing those who were symptomatic. So if you're not really testing that population, you don't really understand. But very good evidence and science has come out showing that children, when they are evaluated and doing this, they can have just as high or higher viral loads than adults. So children do get the disease. they are affected by long haul syndrome. The other myth is masks do not work. Well, that's absolutely not true either. We have plenty of larger data from counties, from states, from country data looking at masking regulations and what they happen. But we also do understand that masking in itself is not the panacea. It is a combination of those things, and we've talked about that's that Swiss cheese model. We know that the way to keep children safe in school is by a number of those pharmaceutical interventions, which is masking, distancing, hand washing, good ventilation, and then now, of course, vaccination for those kids that are eligible for vaccine. There's a recent MMWR article, I think from May, which did show from studies in, I believe, Georgia, that looked at masking and ventilation, and that was able to reduce the incidence of COVID-19 in those schools by 37%. So we know how to reduce transmission. So that is very important. So I just would beg people that are making those decisions, just understand and make those decisions based on true information, not opinions or false information. Again, those myths that I just talked about. Because I think my biggest fear, too, like yours, is that if the kids don't go with masks and if they are quarantined, then they will have to be home. Or if those adults in the school get sick. And we know that there were teacher shortages last year. We know that there were substitute teacher shortages. If there's nobody to be in those classrooms, then those kids are going to be home. And I don't believe there's a lot of psychological problems from masking. And again, please correct me, Dr. Nawalanic. But I think what the big issue is, when we've seen increased opioid and drug dependence rates, increased suicide and depression, that is from that isolation that comes from being at home. So I think the main goal is, what is the best way to direct those kids to be able to continue to be in school? And so I think with knowing that we can cut down the incidence of transmission in the schools itself, obviously we have no control over the kids when they go home in those social situations or extracurricular activities. But in that school classroom, we know the ways to do it, and we just got to make our decisions based on the truth there and some of those things I just talked about. But I think our main goal is to really keep the kids in school because we know the benefits of school. Socialization, safe place, emotional health, school lunches, all of those things. The way to do that, we know, the non-pharmaceutical interventions and then vaccination.
All right, thank you for that, Dr. Hawkinson. And then one last thing before we go to community questions. I want to believe as a parent that all these parents that are not pro-mask, they would never hurt their child.
No.
And how do they reconcile? Or how do we reach them, I guess? Just keep educating?
I mean, I think exactly this conversation we're having right now around the fact that this isn't, masks aren't disruptive or as disruptive as some people would like for everyone to believe that they are. This is the effective way to handle this. And I think that we need to look at the importance of parents leading the way here. And so when we've got parents who are, because they're going to steer their kids to whatever their belief system is. And it's just about doing the socially responsible thing of informing yourself with, as Dr. Hawkinson said, real, actual, credible information from experts, not opinions. And that is so important because, I mean, just for a simple example of how misinformation gets started, there was a thing the other day I saw got flagged. Somebody had a quote that got flagged. And they're like, how does a quote get flagged? I was like, immediately I thought, probably because it's misattributed. Like it's not actually, it wasn't said by that person. And yet they'd held on to this and accepted it as fact. And so it's that simple that when we see something online, we just presume that it's been properly vetted and that it's an actual credible source. And that is not the case. And it's time for us to wake up and accept that reality, because if not, it's our peril. And what we're seeing right now is this resurgence and the way that it's going, and people who have been on the other side of things who are dying, which is horrible. And I see some people on the left try to take some sort of sense of satisfaction in that it's karma. And I'm like, let's not do that. Let's not go to this nasty place. Let's come together and recognize who the actual enemy is and why we're doing what we're doing. There's no vested interest here in masks. We don't have stock in mask companies. We have stock in wellness and in health, and that's what we're looking for our community to have. So please just listen to actual, credible facts and information from vetted medical professionals.
All right, thank you. It's time to get to community questions. And we've got one super mom who's going to help us get to those today. Hi, Jessica. How did Dom do going on his first day of school?
Yes, first day of kindergarten. I on mute? Hold on a second. Can you hear me okay?
You can. It's kind of echoey.
Okay, so here, I'm going to take this out.
Maybe
So
get
yeah, he did pretty good. Apparently, I'm so embarrassing though to my other daughter that she ran ahead of me, and I didn't have to really walk her in. So that's why I was able to get on this call pretty quick. But it went well. He wasn't expecting me to actually leave, but I said, yeah, that's how it goes. So, but I'll be back later.
All right.
So
That's
it was good.
So do we have-
It's always harder on the mom than it is the kid. So.
Oh, yeah. Yeah, for sure. Every mom watching this knows that. So we've all been there.
Right,
and done
exactly.
Yeah.
I just before we get to some of these questions that are coming in, we are getting some about breastfeeding and vaccine and pregnancy and vaccine. And I just want people to know that Dr. Alt's going to be on tomorrow for Follow-Up Friday. So we'll hold off on those questions and make sure that we get those answered for folks. I do have a question, though, from Isaac this morning, and it's on topic. And I know you touched on it being transmitted through the eyes, but he wants to know how easily it's transmitted through the eyes. Should we be wearing face shields along with the masks? He thought that Dr. Hawkinson and Dr. Seitz had said that we didn't need that, but that was maybe pre-Delta.
So I'm not sure the exact numbers of how easily it's transmitted through the eyes, but I think, if you're in close contact with people for an extended period of time, I'd definitely recommend eye protection, face shield, something like, these glasses wrap around, they're safety glasses, but you can get these at Home Depot or on Amazon for a couple dollars. So, like I said, if you're kind of in close contact, like if you can reach out and touch a stranger and you're going to be in that position for 10 or 15 minutes, those are the situations I would recommend eye protection. But if you're going to the grocery store and you might pass someone for a second, I don't think it's necessary in that situation. Of course, it never hurts to be careful, but I think your chances in that scenario are pretty low.
Yeah, I don't think it's a large proportion. I think if you're in certain situations, especially the healthcare system, or if, say, you are traveling on a plane, we would certainly advocate for eye protection. I don't think we've ever advocated really for normal, regular eye protection. Just as you said, if you're going into the grocery store, if you're doing things in a social situation, it's a lot more for the healthcare, places, such as doctors, hospitals, dentist's office. We know that those people are working very closely with patients and come into closer contact. But for the healthcare situation and travel, whether it's on a bus or train or airplane, any time when you're going to be in close proximity to people for a long time, it's a good thing to remember to do. But regular, normal social things like going to the gym or going shopping or things of that nature, it's probably not needed. Do you get some benefit if you wear glasses and or sunglasses? Possibly, but that would not constitute eye protection in a healthcare facility. So it can happen. It's probably a low percentage. I think the majority, though, is going to be through the respiratory tract, either the nose or the mouth.
Okay, Jennifer says, today is our son's first day of high school in KCK. Yesterday, the teacher told her that the only COVID precautions they're going to take is masking and hand sanitizing, but no social distancing, no open windows, no wiping down between classes, 600 students where this kid will be. She feels like she's sending her kid into the lion's den and worried that he could be bringing it home. What advice can you give her? What insight do we have?
How about Dr. Hawkinson?
We're all loaded.
Again, I think we know the things that help protect everybody in those enclosed spaces, whether it's schools or churches or any other area where there's people gathering. And it isn't just one panacea intervention. It's that combination. Certainly, we know masks help as well as the distancing as much as possible. The ventilation, as much as possible. So I think you just have to take those things into consideration. If your child is old enough, please get them vaccinated. Again, I think that's going to be good for the children. They will have a reduced risk of long haul syndrome. They'll have a reduced risk of the multi-inflammatory system syndrome. They will probably not have to stay out or be held out of activities as other kids may if they have to quarantine or things of that nature. But again, in that classroom, in that institution, we know those interventions which help, and is a combination of all of those things. So if you can maybe talk with your student and just say, if you can, please maintain some distance. If you can get outside and do things out there if you can. But a lot of this does also boil down to the engineering in that certain institution or that certain building. Some schools we know just don't have the ability to have that de-densification, that increased space, that otherwise good ventilation. So a lot of it plays into the individual school that child is at as well.
Several people asking about just updates or information on the booster in general. What can we tell them?
Yeah, I mean, right now, the vaccines that we have, again, 2 mRNA vaccines and 1 adenovirus vectored vaccine, all provide very good protection from all of the variants that we've identified so far, including Delta variant, for going to the hospital for severe disease and death. And what we are seeing is 95% or more of the people in the United States that are in the hospital are those unvaccinated people. 97% or more of the deaths that occur in the hospital are those people that are unvaccinated. So the vaccines right now, unless you are part of those special populations that have immunosuppression for one reason or another, because you're on immunosuppressive drugs for organ transplant, because you're on chemotherapy for cancer, because you have a blood cancer, maybe you're on some sort of immunosuppressive drug for rheumatology purposes, you really should be okay if you're not in those subpopulations. So right now there's no recommendation on additional dosing. We know certainly that the Committee on Immunization Practices will be meeting, I think, tomorrow, which is the 13th. We will have Dr. Alt on as well, and they'll be making a recommendation. So far, there is pretty good data about certain immunosuppressed populations and doing additional dosing, but right now, for the majority of people, if you don't fall into those categories, you shouldn't need any additional dosing, because the vaccines that we have right now still provide that great protection against the whole spectrum of COVID-19, but especially that severe disease and death.
A question on topic today is from Kim, and I'm glad she asked it because I have the same one, is about blue light glasses for kids. Are those effective? Do they really work? What can you tell us about that, doctor?
So there is no evidence that there's any need for blue light glasses or that blue light is harmful to the eyes. So I don't recommend them. Some people do find looking at the computer screen more comfortable when they're wearing the blue light glasses, so it's certainly not going to hurt you, but there's no medical indication for blue light glasses.
Good to know. Okay, so a couple of questions have been coming out about double masking. This viewer says, if I'm vaccinated but only have cloth masks, should I be concerned? I work on a college campus. Do I need to be getting a surgical mask or just double masking my cloth masks?
I think what we've stated kind of midway through the pandemic, when some of that, one of those seminal papers came out that looked at double masking. Again, for that double masking, it was only a surgical mask covered by a cloth mask. There was no other studies done regarding double masking. And I think what the CDC stance is that really more important than the material at that point, because most people are going to either have a cloth mask or a surgical mask. Some people, particular healthcare workers, may have actually N95 masks, which is a little bit different than the KN95 mask that you can buy at some of the hardware stores. But I think the more important point to those, even with the KN95 or the N95 mask, is the fit. And I think that was their main guidance, was even with the cloth mask, the surgical mask, or the double masking of the cloth and surgical mask, it's really maintaining that fit and keeping it fairly tight around this area so that you're not breathing in excess air from the outside. That way you can get droplets when you breathe those in. So I think it's more about the fit of the mask. And certainly if you would like to double mask, again, the only guidance is really that surgical mask, and then on top of that have a cloth mask. But we've just talked about how difficult it is to get masking, approved or acceptable, because there is such consternation about it right now. If we can just get one mask on, I think that's adequate enough.
Debbie wants to know, do kids need eye protection at school since they aren't going to be social distancing as much?
Yeah, I mean, that's a good question. I don't think it's probably necessary at school. And I'm talking about like pretty close contact, like in my job, I'm about 12 inches from someone's face all day long.
Yeah.
But even if, in normal times, the next kid at the desk is not that close to you. So, I think I'm not going to send my kids to school in eye protection. So.
Going to feel good if you get a mask on them, right?
Yeah, well, my kids don't mind wearing masks whatsoever. I had the same thing. Like, I have to remind my son, no, you can take it off now. Or he puts, we're going somewhere, he puts it on 20 minutes before we leave. And we're like, you don't need it yet. And he doesn't care. He's like, I know.
There is no guidance on that. I certainly wouldn't recommend it. I know for me, it is definitely hard in the hospital. I do have a lot of fogging in there. But I'm able to do it, and I want to push through it. Because I know that the protection it offers me in the hospital, but I don't think I would give a recommendation that children need to be doing it in school or other settings. And again, general for most people in those social settings, whether you're at school, at the grocery store, at the gym, I wouldn't necessarily recommend it either. That certainly is a big burden, and I think that would probably impact kids because of just the fogging issues.
All right, thanks, Jess. I think that I've got a couple here, if that's okay, and just have a cup of coffee, breathe. Try not to watch the clock too much. He'll be home very soon.
Okay.
And I'm sure he'll have a good day. You'll have to tell us tomorrow. Just a couple of questions here.
Tell Dr. Nawalanic I'm going to have to call him later. He's going to have to calm me down a little bit.
I was just going to say, or you could just enjoy your day and do whatever you want to do.
Yeah.
That's fine too.
Okay, I like that advice. Just enjoy the silence. Okay.
Don't get too crazy. She still has to work.
There's that.
Yeah, there is that. Yeah. All right. Thanks. Tiffany wants to know, Mom always said, eat carrots. They're good for your eyes. Is that true?
I mean, vitamin A is good for your eyes. Really, it's going to cause a problem if there's a vitamin A deficiency. So most people in the United States have a healthy diet, that there's not a risk of vitamin A deficiency. But they are good for the eyes, and having a good, healthy diet is good for the eyes, just like the rest of your body.
And John wants to know, can you get eye damage from screen time? And if yes, is it reversible in kids?
So I don't think screens really damage the eye, and there is some evidence that kids who spend more time indoors, more time looking at screens, are more likely to be nearsighted, and kids that spend more time outdoors are less likely to be nearsighted. So, there's lots of reasons to limit your kids' screen time. You wouldn't want them on the screen all day long, but getting them to play outside and getting them fresh air will help their eyes and help their mental health and physical health and lots of other things.
All right, and I have one more question, and this one is for Melissa, and it's for Dr. Hawkinson, rather. She wants to know, how long would I shed the virus if I don't even know I'm sick?
Mm-hmm. Yeah, I mean, our best estimate and guesstimate, and this is based on viral studies, infection and viral dynamic studies that have been done, that have been pretty well done. It really hasn't changed since the beginning of the pandemic. And shedding virus, you're going to probably shed the most amount of virus that 1 to 2 days prior to symptoms, to about 1 to 2 days after symptoms start. After that, the ability to shed virus continues to go down, and by about that 8 to 10 days, you're probably not shedding too much infectious virus at that point. Your body has kind of overcome that and been able to stop replication. Now, that is historically has been true with all the variants. I think we're still learning about Delta variant. I'm not really convinced about some of the other stuff. I think the information is still new, and I think there's a lot of questions to be asked and answered about Delta variant. But in general, again, it's going to be 1 to 2 days prior to symptoms, to about 1 to 2 days after symptoms start, and then your shedding of the virus is going to go down from there. So by about 8 to 10 days, you really shouldn't be shedding any more infectious virus particles.
Okay, Jessica, do you have any final questions?
Well, I have one of myself to Dr. Nawalanic because I have to get his free advice. Can I ask him a quick question?
Do it.
So a lot of parents have a lot of anxiety, like I have right at this very minute, but it's not about masking, and it's not about safety for health. It's more concern about being hindered by their learning. I have a 5-year-old, and I feel like the masks are going to hinder him being able to see the teacher and learn those basics that I feel like he needs to learn. Do I just need to let it go? I'm asking for all parents with young kids in elementary school. Should we just let this go? Should I be working with him at home, or should I just say, this is just what it is, he'll catch up later?
I think that working with him at home is always going to be a good idea. It's a great way to connect, and it's a great way to let him know how important and how valuable education is to you, and you're kind of modeling that interest for him. I don't think that there's any information out there that suggests, and I don't see anything from my kids from last year, who both were littler kiddos, that there was any deficit or detriment to their learning based on wearing masks. So you can just let it go.
Okay, I'll text you later with all my other questions.
Let it go.
Yes. We're all singing that in our head.
I know, right?
I perform eye surgery with a mask on. Always have, always will. If I can do surgery where millimeters make a difference, a child can see a blackboard and learn in kindergarten.
That's an excellent point. Any final thoughts from you today, Dr. Wishna?
I just would like to echo what I said before, that, we are a community. We are all in this together, and we all need to do our part to get through this pandemic. We're each as important as the next, and, getting vaccines and wearing masks right now are the path through that. So, please make that decision for yourself and your family, and please, talk to friends and family who may feel otherwise. It's going to take every single one of us working together to get through this.
Dr. Nawalanic?
So number one, I think that I come a little hot sometimes, and I'm really attacking the other side. And I wanted to take a moment and go the other way and pivot and give credit to those of you who have gotten vaccinated, who are wearing masks, who never really stopped wearing masks, as a lot of us who got vaccinated, we did. We just kept wearing it because we knew that we got the looks from the people who weren't wearing masks, and we could tell that they weren't vaccinated. So it was just the better, safer thing to do. And that's exactly what Dr. Wishna is talking about, putting everybody else, let's put our community first. And what I would say is, one of the things that I hear a lot of times is people wanting to fight a battle about liberty around this. And the reality is that if we look back throughout our nation's history, liberty has always come with a price. And in this moment, that price is social responsibility. It's a willingness and an importance in engaging in actual credible information and making positive and adaptive and informed decisions. And so I tell all of you, just take care of yourselves and take care of each other. I don't think that's too much to ask. So let's do it.
Great words.
Yeah.
Dr. Hawkinson, beat that.
Yeah, we
Top
always
that.
love having Greg on. It does, it makes it a little bit easier show. When I was growing up, we were talking about not screen time, but other things that might affect your vision. Just seems how things have changed quite a bit. And now we're talking about itis and screen time. So, I think it's been a good show. But, again, back to Greg's point, I think all of these decisions that are going to be made, again, as I stated earlier, are difficult decisions. There's so many people that are pulling these people who have to make these decisions in so many different directions. But we just pray and help to inform you so that when those decisions are made, it is done with the most accurate medical information. As Dr. Stites said, we like to stay in our lane, and that's what we try to do. So it is the most up-to-date, accurate medical information. All of the other issues, we are not experts on per se, but there are other people who are experts in those things, such as spiritual, psychiatric, all those kinds of issues. But we continue to provide you with the most accurate medical information about coronavirus and all things with that. So I think everybody should have compassion, just like he said, and we will pray that the correct decisions are made.
All right. Thank you so much to all of our doctors in our panel today. And I want to tell you my final thought, which is how much I appreciate you, because you are the megaphone for all this great advice that we are getting from our physicians. So a big personal thank you for showing up again today. Tomorrow, it is Follow-Up Friday, and we will get to your questions from the week. And as Jessica mentioned yesterday, CDC guidelines changed to include pregnant and breastfeeding people. And that is because those people and those who have been recently pregnant are more likely to get severely ill with COVID-19. We're going to hear all about it from Dr. Kevin Alt, OBGYN and member of the Federal Advisory Panel for COVID-19. So, thanks for being with us. Plus, don't miss a show. You can subscribe to podcasts of the Morning Medical Update, as well as Open Mics with Dr. Stites, now available everywhere the podcasts are available. Have a great day.